Well, thank you so much for being with us in Morning at NTV. Now, as we continue, of course, the other big conversation that is on everyone's lips is continuous, to be particular, that are happening on our roads. Just in the Daily Monitor this morning on page 7, they get to write about the Bukoma Simbi weekend accident and they get to name the victims. The police has named the victims. Witnesses say the driver of the vehicle was speeding. Issues that are pertaining road accidents just between April 24th and May 14th. You're looking at more than 120 people that have perished in road accidents. As far as police records are concerned. Now, that's unacceptable. I am holding in my hand right now a book, Road Traffic Injuries and Deaths in Uganda, a survey upon which there has a contribution of Dr. Olive Kobusinde, Principal Investigator, who's joining us to have the conversation and help us answer the question, is there an answer to our rampant road accidents? Good morning to you, Dr. Olive Kobusinde.
Good morning, Priscilla. And let me first say that it's wrong, it's inappropriate to call them road accidents. They are not accidents at all. They are crashes. They are predictable, they are preventable, so that stops them being accidents. Accidents are things that you can't predict and so you can't prevent.
Okay.
And we study them, we study the patterns of road crashes, we know where they're going to happen, when they're going to happen, to who they're going to happen, and we can prevent them. So
for example, the most recent ones that we have had with the link bus and the other two accidents that happened in the other. Right. How do you exactly, say that those were crashes, predictable and preventable?
So even without, going into very high-level research, everybody will tell you that, oh, we know that corner, we know that place, it's a black spot. What they're saying is that place is different from lots of other stretches on the road. It means that there's something about that space that makes it prone to road traffic crashes. So likewise, we've studied where road traffic crashes happen the most and where fatal ones happen. In fact, in the report that you're holding, we give results of a road audit that looked at crashes that had happened and, serious fatal ones, and we identified places in the road network where there were more crashes, more deaths. Okay. We did an audit on those places, and so we can tell that if nothing is done on this environment, they're going to continue to be crashes. It's not human error, otherwise they would be equally spread over our network.
Okay, now of course we do have regions, so can you give us those most dangerous spots that you have highlighted in this research according to the northern region, east, west, south and central?
Well, so surprise, surprise, I know that right now people are thinking about these long distances, between cities. Definitely. Actually, 2/3 of deaths that happen on our roads in Uganda are happening in the Kampala metropolitan. So they're happening very much around us. They're not happening in 20 people dying in one crash. They're happening in 2 border guys, 1 child, 3 kids, 1 woman crossing the road. And because they usually are happening, 1s and 2s, they don't get the kind of attention that the link bus gets when 20 people die on the road in one instance. But so in addition to the Kampala metropolitan area, where we picked on lots of places, for instance, the Chibwe roundabout area, Kalere, post office, would you believe that people are having serious crashes, along that stretch? Ginger Road, a number of spots along Ginger Road, along Gayaza Road. So outside of the Kampala metropolitan, we had areas along Ginger Road outside of the metropolitan area. We had places in Gulu. We had places in Kabale. We had places on Masaka Road. So these are corridors where it's predicted that they're going to be crashes.
When you say Gulu, Kabale, those are very generic. Dr. Olive, give us those particular areas, the names of those areas. Because these are, routes that people use on a daily, but they may not be as conversant that those are hotspots for crashes, as you
Right.
said.
So for instance, in Luero, which is another area that we have a 1.5 kilometer stretch along Kasana where it's predicted, there have been fatal crashes in that small space, that's every year they're going to be 10, 15 people die on the same spot. It is not an accident. It is predictable. We need to study that stretch. We have stretches in just outside Gulu city, on the road that is exiting the city. That is not even 1.5 kilometers. It is like 500 meters in the same spot where crashes are happening on a regular basis. So we can, and some of these have been reported by the police before, and they say, oh, this is a black spot. And they sometimes even put a sign. Instead of fixing the problem, they just put something that a driver should read and somehow do something different. So we know what these causes are. We're just not addressing them.
Okay. All right. Looking at the report here, I'm seeing a summary of data collected by data source and tool. Records of traffic crashes, 7,065. And then when it comes to the individuals that are involved, you're looking at 5,026. That's by police records. Then the health facilities have gotten 8,425 individuals involved in crashes, as Dr. Olive has educated us. But then in mortuary, you're losing 598 people. Now, those are families that have been crushed, devastated. Those are livelihoods that have been changed. Those are futures that have been altered by these deaths. Now, from this quality assessment here, I see that you've also had to work with the Uganda Police Force. You've worked with the Ministry of Health, Works and Transport, Forum on Road Safety, and the KCCA, among others. Now, what is their contribution in this research report? So,
this particular one, we were looking at police reports a certain number of people a certain number of crashes, injuries, and deaths. And we were suspicious that these deaths are actually, that there's an undercounting going on, because we are aware that some crashes may not be brought to the attention of the police, or they might be brought to the attention of the police, but the injuries that wind up in hospital, when they die, the police doesn't update its records to make that a fatality. But we also know that there are patients that wind up in hospital and that have a crash that don't end up in the hospitals where these data are being collected. In other words, the reports that we get from the police are different from the reports that we get from the health facilities, and we needed to have a unified picture to be able to say exactly what is the burden. So that's what we looked at, and we discovered that, for instance, in the exact same period when the police said that 3,505 people had died on our roads, we found that 7,558 people
That's literally triple the number.
More than twice the number. So police is not lying about the numbers. They simply do not have the capacity to capture all the data. Right.
Okay.
Right.
All right. And so in terms of recommendations, then when you look at police, Ministry of Transport and Works, and maybe KCCA, and all supporting organs, how do you then recommend they are able to collect this data to come up with, numbers that actually resonate with the realities of crashes?
Right. So one of the things that we did was to work with the police to see how can they improve the quality of their data. And one recommendation was to digitize, because right now what we have is a manual system. A police officer goes to the crash scene, records something on a piece of paper, walks back to their station, puts it in a paper report.
In a book, yes.
And at one point, these pieces of paper should wind up at a regional police office where they then are fed into a computer. That is fraught with a lot of errors. But it also means that the information at the scene can be easily lost. So we worked with the police to actually develop a digital system that is right now on the table being considered for implementation. We are also working with the health service, the health facilities, to see how they can also improve the kind of information that they capture, and how both these, we actually also went to the mortuaries where incidentally a lot of deaths that happen and people end up in mortuaries, they then don't show up in any other data set. Yeah, so we're trying to see how, once you have these improved data sets, how can you then use them for prevention? So for instance, what do we learn from the police data if it tells us that in Kasana, the majority of people who are dying are not inside a car. It's not a rollover and car occupants are dying. It's they're wiping out school kids. What are we going to do to that spot to make sure that children are protected as they walk along the road? What are we going to do as the health sector to make sure that if there's an injury, if it's not an instant fatality, that person has the best chance of survival? In other words, our emergency medical services are placed in such a way that they can help those where we know that crashes are going to happen.
Let's talk about the emergency medical services in Uganda here. Already when you put it in reference to police response to accidents, the delay is one that actually leads to death in so many cases or some instances of people because of that delay. Even the emergency response teams, how long they get to actually come to the scenes of the crashes, the accidents, and then the response thereof to the nearest health center that has the facilities capable enough to handle some of these injuries. It's a whole cumbersome thing that we're looking at. So let's talk about a response in terms of emergency. Who is to blame?
Who is to blame? Maybe we shouldn't start there. But you know what, Priscilla? Emergency medical services are rather like television. You know, what people see here is two ladies chatting. What's behind us is a whole big team of people doing lights, doing sound, doing, management, gathering information. So this whole team in emergency medical services, what people want to see is an ambulance on the scene, a nurse there, and somebody is whisked off to the hospital. Behind that is a whole big structure of leadership and governance. Who manages these services? Of financing. How are they financed? How do we ensure that ambulances are available? They have fuel. They have staff that are trained, that are paid. You have human resource. Who works in these services? What kind of training do they have? What kind of experiences? Who supervises them? Who monitors them? How are they paid? You have supplies. You know, how is it that we have oxygen or no oxygen? Do we have the medicines that we need? Do we have, what kind of data are we gathering and how are we using it? So that emergency medical services, this whole big orchestration is what we would like to see. Currently, it's not in place. And by the way, when you say that the police are delaying, really, the police can help, but their primary mandate is not to take patients to hospital. We need to have
so that
people
falls on the health sector.
Exactly.
There's been a talk of a centralized ambulance system. Would it work to actually aid in one of these challenges you've mentioned?
So that's part of the orchestration that I just mentioned.
Okay.
And when we say centralized, it doesn't mean that all ambulances are in the same location. It means that their management is unified, that all ambulances, regardless of who owns them.
That's what I was going to ask, because now we have more privately owned ambulances than we do have publicly owned ambulances. So how do we get to streamline matters to and utilize the resource ambulances?
Right, so it shouldn't be dependent on the person that's lying on the road to decide, I wonder which ambulance should be called for me. That person has no capacity to decide. What we need to decide ahead of time is what kind of management we want to see, that is going to, that we have a call center, for instance, that when whoever shows up at the scene calls a number that is well publicized, that number is picked by a competent person that then decides on, okay, what's your location? How many people are involved? And is able to say, this vehicle is coming out to pick you up, and direct the vehicle on where they're going to take these people. And the vehicle is going to arrive with staff competent to assess the nature of the injuries and where the person should go. So we want to see that orchestration, and it's not going to happen from, the 30 different entities that each own one vehicle that they call an ambulance. We have to have standards for, and by the way, the Ministry of Health actually has determined standards for ambulances. And we have a new emergency medical services policy as recent as September 2021.
And what does it entail?
All these wonderful things that haven't started happening.
Okay. So that's why the challenge, I think, for the end user or the Ugandan is that while we do have all these recommendations and implementations, surveys and reports that are being produced, converting that information, that data into implementation that can actually benefit the Uganda is where we are not being serviced as Ugandans. Now, as you, in your capacity, how do you recommend that gap is bridged sooner than later so that we can reduce on the number of casualties, deaths and crashes in a whole framework?
So Priscilla, people like yourself who read these things and who are aware of, first of all, the size of the threat and of the burden, and who are concerned. You know, ordinary citizens need to be able to demand better. We shouldn't just say the Ministry of Health is planning for us, fully aware that right now, as we speak, if crashes are happening out there, they know numbers to call, they know ambulances arriving, a police truck is going to come and probably shove people on the truck and ferry them to Mulago, regardless of how many capable hospitals they're going to drive past. You know, that needs to stop. I think we need to challenge government to do better, because even while the private sector and maybe NGOs might be willing and able to contribute, they shouldn't be the ones that drive something as critical as the national emergency medical services. This is something that we all need to say, no, it's unacceptable. We know what to do and we know how to do it. Okay. We may have gaps. In fact, one of the huge gaps is the personnel. How many people are qualified to be emergency medical technicians, for instance? So a person shouldn't arrive on the scene atop a vehicle or an ambulance and they really have no capacity to evacuate a patient, to quickly assess their level of injury, and to determine where that person is supposed to go. And these are things that we are like 30 years behind in terms of building that capacity.
Okay. Dr. Olive, finally, there's road safety. You've talked about Kampala Metropolitan being one of the hottest spots when it comes to crashes, sadly. True. And yet, from the looks of it, it looks like we have the pedestrian lanes, you have the non-motorized lanes.
Priscilla, where do you live?
In the Metropolitan. So according to your findings, what is the pedestrian infrastructure in the Metropolitan area code? Right? So
really, pedestrian infrastructure, we would have to say, is pretty much non-existent in most of the metropolitan area. It is, we have a non-motorized transportation policy. Uganda is famous for policies. We have such a policy that was finalized in 2012. It has not been implemented. In fact, in one of our research papers recently, we highlighted the problem of implementation. What do we do? So we need to get back to that policy and say the majority of people who are moving about in the metropolitan are moving on their tools. They're either walking or they're on two wheels. How do we make space safe for them and also safe for those that are driving in cars? So we need to be putting in pedestrian facilities. We need to be making sure that in areas where there are huge numbers of pedestrians, we either limit motorized transport or we separate it in such a manner that there's no chance that a vehicle is going to run over a pedestrian.
Especially the trading hub that we have downtown Kampala. There's definitely a lot of that is missing. Right. Now we want also to turn our attention to the report that was released by government in reference to the link bus services, and you know, they had been given a ban for some days. Now you get to look at some of the findings that came out of this report, and some of them are actually very interesting. You get to look at training of drivers. You get to look at the nature of the buses. They say it was the bus in particular was in good nature, and it all comes down to the motorist, the driver who was in control of this bus, and he
not in control as it turned out.
Not in control as it turned out. You have people perishing because of overspeeding in such places and the sharp hotspots that you have talked about as this. How do we get to remedy this particular issue?
Yeah, this has been a really sad incident. Sadly, it is not rare. Right now it's fresh in our minds, but lots of such crashes have happened in the past and we somehow move on. So let me first say that while people like to say, oh, it's human error, we've just discussed that it's quite often not just dependent on the one person. It's dependent on the nature of the road on which they are driving. It's dependent on the vehicle they're driving and on the person that's driving it. So speeding is one of the top reasons that crashes happen, and that they happen with such severity. So that if there was a crash in the same place, but the driver, instead of driving at 90 km/h, was driving at 45, they might not get off the road, or it might not be the same level of damage. So speeding has to be dealt with. Driver training is a big deal, but also enforcement. You know, the kind of drivers that we get, we understand that actually many of them have not been trained to drive heavy vehicles. They train to drive the little cars, and then they somehow progress to become a town boy in a truck, then in a bus, and then finally they drove the bus. So they really may not have the right training and experience. But we should have the systems that prevent such people from being behind the wheel of a bus. So for instance, we could insist that they go through a certain type of training, that they demonstrate experience before they are allowed. In the same manner that when we train a doctor, after 5 years, we insist that they do a whole year of internship, so they are not practicing independently.
Right.
And we do not license them unless they have passed their internship. So why do we license people to drive buses that we have no assurance that they have the right
yes.
experience? But coming to buses as well, you know, there's such a thing as limiting the speed at which a bus can go. This technology
which can be done mechanically.
Absolutely. And this technology is not new. It's existed for decades. Why are we not insisting on it? So that if a bus company removes the bus governance, we discover that actually their buses can run at 100 when we know that the highest is 80, that bus is deregistered. But we allow buses that can drive at 120 when we know that in our network, that bus is not going to be on a road where that speed is allowed. Why? So it's a question of regulation and enforcement, and we just need to be on top of it.
All right. Regulation and enforcement in response to action plans and commitment by Link Bus Services. One of the tools that they're going to be applying is management of injured victims and burial of the dead, of course, after that Link Bus at Fort Portal. Then you also get to look at another action plan from Link Bus, continuous training of their drivers, something that you have talked about. But I like how Dr. Olive has put it in the sense, in the medical sense. If you can have interns going at it for 1 year to just make sure that they've very much understood what they're signing up, thereafter you can verify them and you can credit them to become doctors to service the rest of the nation. That definitely makes a lot of sense. They're also committing to review and strengthen driver code of conduct. They're looking at ensuring adequate rest for drivers, especially in terms of return trips, because it's a business at the end of the day.
And it is something that you can say you report at these points at these times. So if you're found in Fort Portal and you only had 3 hours, how did you pass Luwero? At what time did you, or whatever points have been on the way?
Okay, all right. Of course, strengthening the driver disciplinary committee is another action plan that they're committing at. Passenger involvement in monitoring, reporting driver behavior. This one has failed because, in all honesty, I'm sure when you used public means, a driver would overspeed and you tell them, and the response is one that shuts you up, and yet it's your life that is in their hands.
And everybody else might keep quiet. Why are people keeping quiet on these buses?
Okay. All right. Commitment to work with the ministry and other stakeholders and sharing experience with other bus operators. Creation of a position of a safety officer. I think all this is just, you know, the application of it is very important. So we'll definitely be following up that application with Stephen Bitte one of these days while he'll be going on ground at the Link Bus this particular week. In your parting shots, Dr. Olive.
I'd like to appeal for government to be involved in creating an affordable, accessible and sustainable public transport. Public transport public means that the public has a stake in it, and it's not just a stake that we ride the buses or it means that we've put a certain amount of money, we've put some kind of subsidy so that government actually has the moral authority, has the leverage to control, to regulate. Right now, public transport in the metropolitan is border borders. We're trying to move 1.5 million people every day on 2 wheels. I mean, really, this is unacceptable. So we need to focus on public transport. We need to revive very seriously the idea of rail, light rail to move commuters. Light rail is affordable when it eventually is in place. The initial investment is going to be substantial. But the reason we say, oh, it's too expensive is because we think people are cheap. People are not cheap. We need to make the investment, put in the light rail, and reduce the numbers of vehicles that are on the road so that most of the commuters are moving on light rail.
Okay. All right. In other words, let all these government entities put their resources in regulation. That way we're going to be saving a lot of lives in the near future from crashes, as I have learned today from Dr. Olive. Thank you so much, Dr. Olive, and I trust that this has definitely given you something to take note. As a driver, as a pedestrian, as a road user, in whatever capacity, please be mindful. We do have a campaign that we are partnering with Vivo Energy, Twedeco. It's basically real